Swadikap. Good afternoon once again. So first, thank you to Dr. Apisamai, who gave us the Thai language briefing just now. She touched on many important issues, from the caution that we are looking at in terms of our neighboring countries, the border with Malaysia and other neighboring countries, as well as the active case finding missions that continue in Bangkok. So I'd like to start off first with the numbers that we have recorded for today, Wednesday, the 19th of May, 2021. New confirmed case, we have recorded 3,394 cases. Out of this number, there are 3,377 from local transmission and 17 from overseas. So out of the majority of the local transmissions, we can say that half actually were detected in prisons. So out of the 3,377, we have around 1,500 cases which were contained in the prisons. And the remainder, around the other half, 1,007, 1,008, were from actual local transmissions. The cumulative number of cases that are active, still under treatment right now, is 41,903. We have new recoveries recorded today at 4,450, which actually the recoveries today exceed the number of new confirmed cases reported. Unfortunately, we have 29 fatalities reported today, making the cumulative fatalities since the very beginning 678. Most of the fatalities with underlying health conditions, and of these 29 fatalities, in terms of the area coverage, the majority were from Bangkok. In Samut Prakan, we had 5 fatalities in this number. In Pathum Thani, reported 2. And 8 provinces reported 1 fatality each, which were Chha Cheong Sao, Lamphun, Chonburi, Saratburi, Nakhon Pathom, Kamphaeng Phet, Nong Khai, and Nonthaburi provinces. One observation is that the areas at risk, of course, remain in crowded communities, which include, and very importantly, include worker camps, construction worker camps, construction sites, markets, and communities nearby markets, those nearby factories, as well as within factories and office buildings. And risk factors remain about the contact with infected family members and colleagues, travel from areas at risk, and dining together and using shared utensils. The number of cases detected in prisons is also increasing, as you have noticed in the past days, with 1,498 cases detected in prisons today. In terms of the provincial area distribution, yes, as you can see on screen, coming up on screen, the top 10 provinces with reported cases still are mainly concentrated in Bangkok and its vicinity, the surrounding provinces, which is actually the maximum and strict disease control area, or the dark red zone. Now, 34 clusters have now been detected in Bangkok, which comprise of 29 that we mentioned yesterday, as well as 5 plus 5 new clusters today. And during this outbreak, the active case finding still continued. As of yesterday, the 18th of May, more than 300,000 active case findings have been conducted in Bangkok and its periphery. Of this number, the positive rate is 3%, those found to be infected. And health authorities continue to give the utmost importance to contact tracing and request all confirmed cases to alert their contacts so that they may isolate themselves and observe their symptoms as soon as possible. Yes, so on screen you have the provinces in terms of the new cases: Bangkok, Samut Prakan, Nonthaburi, and other provinces near Bangkok as being among the top 5 provinces in the list that you see. Now, in terms of Bangkok itself, in terms of the Erawan Emergency Medical Center, I'll talk a little bit about that. The Bangkok Metropolitan Administration had upgraded the Erawan Emergency Medical Center to become the headquarters of the COVID-19 patient management in Bangkok. And the BMA will cooperate with relevant authorities to speed up operations so that patients can receive medical treatment in hospitals, field hospitals, and hospitals as soon as possible. and you have a visual up there. The officials of Bangkok Metropolitan Administration also informed that 3 teams have been set up to accelerate the management of COVID patients. And Busara Kam Hospital will be responsible for the north and eastern part of Bangkok. The reception center at Nimitbut Stadium will be responsible for the central and southern part of Bangkok, while the Bang Khun Tien Geriatric Hospital will be responsible for Thonburi side of Bangkok. Moving to another province which may be of interest to foreign nationals here in Thailand, on Phuket. Phuket's measures. Phuket has implemented tougher travel restrictions, as we know, in preparation for the sandbox, whereby people entering the province via land, sea, and air transportation must present a negative COVID PCR test result or the rapid antigen test result conducted within 72 hours prior to arrival. And the only exception is fully vaccinated people. And this measure is effective from the 18th of May until further notice. This is for domestic travel. However, travelers who are not fully vaccinated or do not have a negative result, COVID test result, and who wish to enter Phuket can take the rapid antigen test at the checkpoint for a fee. And those who wish to travel to Phuket via land who have not been vaccinated or who are not in possession of a COVID-free certificate issued within 72 hours of arrival will have to undergo the mandatory 14-day self-quarantine under the strict supervision of the local EOC, or Emergency Operations Center in Phuket. And travel to Phuket via land routes is only permitted from 0500 to 2300 hours. And again, this is for the domestic travel, those already in Thailand. In terms of vaccination, I'll touch a bit on that in terms of the progress. On screen, we have Thailand's accelerated vaccine rollout plan. As I mentioned around 2 days ago, the plan had been adjusted because the earlier arrival of the vaccines that we had planned to come around in June. So a bulk of that had arrived earlier. That's why we adjusted in terms of the inoculation plan. And to date, yesterday, Thailand administered more than 100,000 doses of vaccine in just 1 day. The cumulative number of vaccine doses administered up to the 18th of May, which is yesterday, yes, in the chart there, is more than 2.5 million doses already. Of this number, more than 1.58 million doses are first doses, and the rest are the second doses. And very sure that in the coming weeks and months, this will be accelerated twofold or threefold because of the efficiency of administering the jabs in Thailand, where we hope to have 70% ultimately 70% of all persons being inoculated. Of course, we prioritize the issue of safety of vaccines first. And one issue is about the Thai students who are close to having to travel to return to their studies abroad. So the relevant government authorities are looking into that for that particular group as well. I have some additional information that we have now given the issue of vaccination priority as a national agenda. The target for Bangkok in particular is 5 million people within 2 months. Of course, with the supply of vaccines coming earlier and the vaccination rate that we have, there's no issue in the vaccination rate. As we talked about earlier, there were 2.2 million plus doses, and then almost the same number had been administered already in the past month. So there's no problem about the efficiency of administering the vaccines. So the target for Bangkok in the next 2 months, 5 million doses. Priority groups include teachers, university lecturers, before the schools and universities open, the public service providers, public bus drivers, taxi drivers, in terms of the transportation personnel and the like. And the public and private sector are also collaborating to provide as many vaccination centers as possible. And actually this morning there was another meeting in terms of planning for the vaccination rollout, and that will be preparing for the bigger meeting tomorrow afternoon regarding vaccination rollout, including for foreign nationals as well. The priority, of course, safety and accessibility. I have around 2 questions which I'll address. These questions were posed on social media from the English language community. First is question, how many were tested positive for COVID to date since the 3rd wave of outbreak, particularly in Klong Toei? Now, I have some information here is that around 31,000 have been tested already in that area, Klong Toei. And of this number, 1,500 plus were found to be infected, including 94 cases, new cases from today. And this is for Klong Toei. The second question, how is the vaccination progress to date in Bangkok? How many have been inoculated in Klong Toei district? So as of the 18th of May, yesterday, more in terms of Bangkok in general, as of yesterday, more than 400,000 doses had been administered, particularly in Bangkok. Of this number, more than 200,000 were first doses, and 130,000 were second doses. In particular, Klong Toei, don't have particular information on that specifically, but we'll get back to you on that. But in general, the importance that we give to each district that I mentioned earlier remains. The various districts that have the clusters, including Klong Toei. A few months ago, it was other districts, and we'll continue to keep tab of those districts. I mentioned actually many around 10 plus districts in Bangkok yesterday, which the latest active case finding missions will be concentrated on. So we'll try to answer as many of your questions as possible, as quickly as possible, to the best of our ability each day. So, as always, we'd like to remind everyone about the importance of practicing DMHTT. Dr. Apisamai mentioned about that just now as well. The DMHTT remains important. Also, in terms of health care for migrant workers, that's a very important issue for many countries in ASEAN, in Singapore included. Now, Thailand is no exception, of course. We mentioned earlier that the risk remains in crowded communities, which includes migrant worker communities, and as such, the Public Relations Department has prepared infographics on healthcare for migrant workers to protect them from contracting the virus. If you recall yesterday, I showed you some infographics from authorities of BMA, and the Labor Ministry also has that, the Public Relations Department also has that, some infographics in the various languages of the migrant worker communities in Thailand, such as in the languages Burmese, Khmer, Lao, and English. And of course, we've been talking to employers and factories. Employers are advised to monitor the cleaning of accommodations, shared facilities, shared equipment, and providing alcohol gel in designated locations for sanitation, and arrange for the initial screening if any symptoms are detected among their migrant labor workforce. And workers and their families are also advised to observe symptoms, wear masks, wash hands frequently, and refrain from joining congested social gatherings. So these precautions are applicable, of course, not only to the migrant worker community, who are very important to the economy of Thailand, but also to all of us, the general public, Thais and foreign nationals alike, as we continue to remain vigilant and fight the virus together. So thank you very much for your attention, and we'll see you again tomorrow. สวัสดีครับ
ครับขอบคุณนะครับ